Start about the muscles of lateral compartment of the leg, that are nothing but our peroneus muscles. As you can see, this is the lateral compartment. They are separated from anterior compartment and posterior compartment by means of septa. That is, first one is anterior intermuscular septa, which separates the anterior compartment from the lateral compartment, right? And you have the posterior intermuscular septa, which separates the lateral compartment from the posterior compartment. And in this lateral compartment, you find mainly two muscles. One is the Peroneus Brevis and one is the Peroneus Longus, right? So these two muscles are about their attachments, nerve supply, action, everything. Today let us know. So first let us see what is its nerve supply. It is supplied mainly by the superficial peroneal nerve. If you all know that the superficial peroneal nerve is in turn coming from the common peroneal nerve, right? And you know that common peroneal nerve is coming from a sciatic nerve. You know, first the sciatic nerve at the rate of our popliteal fossa, it will divide into the common peroneal nerve and also our anterior tibial nerve. That common peroneal nerve at the neck of fibula, it will in turn divide into the deep peroneal nerve and superficial peroneal nerve. So that superficial peroneal nerve supplies the Peroneus Brevis and Peroneus Longus, whereas the anterior compartment is supplied by the deep peroneal nerve. So actually already we discussed about this, just I am giving a quick review about them. So now let us understand what is the actions of these muscles. The muscles of lateral compartment, that is the longus and brevis peroneus, are mainly everters of the foot. For example, this is a foot. They evert them like that, okay? So they are the everters of the foot when the foot is off the ground, okay? And the movements of inversion and eversion help to adapt the foot to uneven ground. Along with other inverter muscles present around ankle, the peroneal mainly help to maintain the stability of the joint, okay? And the peroneus longus, especially the peroneus longus, help to maintain the lateral longitudinal arch and also transverse arch of foot. So lateral longitudinal arch means, for example, you can see this is the lateral side of the foot. So this lateral longitudinal, this arch like structure is maintained by this muscle, and also the transverse arch means, transverse means from here if you like this. So this both longitudinal and transverse arches are maintained by this Peroneus Brevis and Peroneus Longus muscles, okay? So now let us see their origin and insertion. Let us switch into another diagram. So now let us discuss origin and insertion of these muscles. So first let us discuss about Peroneus longus. It mainly lies superficial to the brevis. You can see brevis is inside but longus is superficial muscle. So its origin is from the head of fibula. I can see here clearly. This is a, you can see here, origin from the head and lateral surface of fibula, right? And especially it is also coming sometimes from the adjoining part of lateral condyle of tibia also. So it is coming mainly from upper 1/3 and posterior half of middle 1/3 of lateral surface of shaft of fibula. So especially it is coming from lateral surface of fibula. Of course, as it's a lateral compartment muscle, it will come from lateral surface of fibula. So finally it will go and insert the tendon, mainly passes deep to peroneal retinaculum and run through the tunnel in cuboid. You can see this is the cuboid bone. So run through the tunnel in the cuboid and inserted into the lateral side of base of first metatarsal bone. So you know the first metatarsal bone is nothing but our grade 2. So it will go and insert into the lateral side of base of first metatarsal bone and adjoining part of medial cuneiform bone. So tendon changes its direction below the lateral malleosus, here you can see, and again on the cuboid bone, and a sesamoid bone a sesamoid is present in a tendon in a lateral situation. So you can see here, this is the course of the insertion of the tendon of Peroneus longus. Hence it is long muscle because it should go a long way, like up to the base of first metatarsal bone, right? So it should go below the cuboid and below near to the medial cuneiform bone and go and attach to the medial cuneiform and also to the first metatarsal base. So now let us discuss about the Peroneus Brevis. So Peroneus Brevis is actually deep to the Peroneus longus. It lies deep to the Peroneus longus and it's getting origin from the anterior half of middle 1/3 and lower 1/3 of lateral surface of mainly the shaft of fibula. So it is also coming from the shaft of fibula but in the lower side, lateral side. So it is also coming from the anterior and posterior intermuscular septa of leg. If you remember in a previous diagram, here I showed the anterior and posterior intermuscular septa. So even from anterior and posterior intermuscular septa of leg also it will have the origin, that is about Peroneus brevis. So where it will go and insert, as it is a short muscle, you can see it is going deep to the peroneal retinaculum and insert into the lateral side of base of fifth metatarsal bone, that is our little toe side. So to the base of fifth metatarsal, it's a short muscle, right? So this is about Peroneus brevis. So Peroneus longus will go and attach, it's a long muscle, it will go and attach to the great toe. But this Peroneus brevis is a short muscle and it will go and attach to the base of fifth metatarsal bone, right? So it will go and attach to the base of first metatarsal bone and will attach to the base of fifth metatarsal bone. So this is about Peroneus longus and brevis, which are the lateral compartment muscles of the leg. Next, in the next video, we'll discuss about the superficial peroneal nerve, right? And next, after that, you have the last topic, that is our medial side of the leg. By that, we'll complete this lesson of lateral medial side of leg and also dorsum of foot.